Hello, hello again. This is Jorge Briones in your show, What in the Health? And today we're going to bring a conversation about what's going on in the market with Medicare and also specifically on a topic that affects too many people right now. I don't know why it's going on this year, but I've been having a lot of questions, a lot of calls, and I thought that was prudent to bring it on the table because it is something that everybody should have an idea or at least an understanding of why sometimes we get penalized. Penalties. What are the penalties? Okay. In the world of Medicare, why do I get penalized? I just retired. Why do I have to pay a penalty? Why do I have to pay $150 out of my check? And then on top of that, I have to pay more money, right? Those are the topics. Those are the comments. Those are the lines that we hear all the time whenever members get the infamous letters from CMS saying, "Dear Mr. Client, because you didn't have coverage from the time that you retire or turn 65, and now that we receive your application, you're going to have a penalty." What it is and why do I get it? All right. So before anything, I want to say thank you to everybody that actually follow us on Facebook, Instagram, LinkedIn. Thank you so much to our partners, especially to our brokerage. A special thank you to Miss Yvette Rodney, Josh, everybody that is actually in our back and everybody that is, at some point giving us the support that we need. JWB pretty much is in the house. Thank you guys. With that being said, thank you so much to Arlene for being the girl behind the camera, for being always, taking care of my crazy schedule and also helping me with everything that we need. And thank you all, you guys, especially the JWB agents, because at the end of the day, this past AEP was rough, but we came through and we actually made it happen. All right, so let's start topic, guys. All right, so what is the penalty and what is exactly the reason that some folks get this infamous penalty whenever they turn 65 or they retire and suddenly they have this letter again saying, "Dear Mr. Client, you're going to have a penalty in your Medicare coverage," right? So let's start from the beginning. Anybody that turns 65, it is required to have some sort of coverage that is called the credible coverage through Medicare, at least something that help you paying for your medication. So you can pretty much be with traditional Medicare when you turn 65. Anybody listen the live video or the podcast will not understand, what is the traditional Medicare. Okay, so let me back up a little bit because I understand probably the agents in the insurance world understand what is traditional Medicare, but any member out there listening the podcast or the Facebook Live will not understand what the term traditional Medicare means, right? So when you turn 65 and you got your Medicare active, okay, let's say you retire in January and your Medicare card said Part A, hospital, January the 1st, 2023, and Part B, medical, January the 1st, 2023, right? If you didn't choose anything and you just pretty much enrolled yourself, for some reason you got an automatic enrollment that could happen in some cases into a prescription drug plan, you are considered a traditional Medicare member. Traditional Medicare meaning that your Medicare will kick in as long as you have satisfied the deductible of your hospital and the deductible of your doctors. Once you have those deductibles paid, Medicare said, I pay 80% and you pay the 20%, right? But what happened if you didn't enroll into a prescription drug plan? What happened if you forgot to call JWB or to just pretty much check on Medicare.gov and see what are your options, right? So if you didn't take action and you didn't enroll into a plan, you will be penalized after 63 days of the time that you were supposed to have your eligibility done or in effect, okay? So some of the times the rule goes, whenever you're going to retire or you're about to retire, Medicare says, "Hi, Mr. Client, you're going to be effective on Medicare Part A and Part B will start XYZ month." Let's just give you an example, January 1st, 2023. So some cases, members are still working and members are still having insurance coverage through their employer. So they will have 3 months in addition whenever they turn 65 or whenever they're going to retire, because they're supposed to continue with this coverage until they make a choice, right? But let's say, for example, you are one of those folks that cannot wait until your time comes and you retire and just pretty much relax, rest, travel, whatever it is, right? And you do not take action calling your employer or pretty much checking with Medicare, and you didn't get a plan when you turn 65 or whenever you're 100% retired. If you didn't have something in place from day one when you're supposed to be out of your job or in effect with Medicare, you're gonna be penalized. You're gonna have a penalty because Medicare said, "Hey, I give you plenty of time for you to choose a plan, plenty of time for you to evaluate your options, plenty of time for you to call your employer and see if this is what you wanted to keep or you want to go on your own." So whenever that happened, whenever that period of time passed, okay, Medicare will charge you 1% of your premium for Part B times every single month of the months that you were supposed to cover. On top of that, you're going to have also a percentage, which is called the index of poverty levels into the Medicare population. So it's a mathematic formula. It's a little hard to describe exactly in detail. So whenever we came across to somebody that have, or we perceive that we will have, that he or she will have that penalty, we don't get into details because there's so many factors in place. We don't know exactly, if the member, in fact, had coverage through their employer. In fact, they had some sort of automatic enrollment into a prescription drug plan. So all the time that we come across to a member like that, we recommend he or she to call Social Security or to call Medicare to find out exactly how much you're going to be entitled of that penalty. Now, there is cases that, we see folks with 2-3 months, maybe a year without a plan, but also we see folks that go in for 5-10 years after they pretty much were supposed to have something and they didn't have. Unfortunately, for those folks right there, the penalty is extremely high, and some cases are actually more expensive of what the actual Medicare plan covers. In our industry, in our plan, we have Medicare plans that have $0 premium, and some others that have $27, $49, $95 a month for a premium on the plan. And usually this penalty, okay, is double or triple of that amount. And sometimes, again, it's hard for us agents to explain to members why the government is penalizing them and pretty much having them to pay in these cases, right? But unfortunately, that is something that is applied through Social Security, through Medicare, and unfortunately, there is nothing that can be done if you're going to be penalized. However, there are some circumstances where some members qualify or fall into the category of being low-income members or having, under the poverty level income. Those folks right there will have the opportunity to apply for certain programs through the state of Texas and also through the government, through the whole Medicare system. The specific one that will help you with your penalty in case that you have a penalty will be the Medicare savings program or the Medicaid for the elderly if they communicated with Social Security for the extra help application, or if you think that you might not qualify for Medicaid. Because one thing I want to make sure you understand, if somebody or you ever try to apply for Medicaid for the elderly or the Medicare savings program, which is called the Medicaid for the seniors, if you got denied, that does not mean that you also will be denied for the LIS, low income subsidy, or the extra help that will help you with your medications. Okay, those are two different programs and two different qualifications that, again, that if you didn't qualify because you are a little too high on the income, or perhaps you have one or two assets above the permissible allowance, okay, that will not disqualify you to apply for the LIS, for the low income subsidy, right? So if for any reason you qualify for the low income subsidy, having this penalty, okay, that automatically right there will wipe off your penalty, and you pretty much will not have to worry about paying the penalty for your Part D, okay? And also, okay, anytime that you get medications that are considered expensive or considered above tier 2, okay, in the Medicare world, we have 5 tiers of medications. Tier 1, preferred generic. Tier 1, preferred generics. Tier 3, preferred brand. Tier 4, non-preferred brand. And tier 5, which is a specialty brand, right? Anytime that you have a medication that it goes above tier 2, usually have a copayment between $45+ for a 30-day supply or $100+ for a 90-day supply. However, whenever the folks qualify for the low-income subsidy or the extra help for the medications, these prices are actually reduced to a flat copayment per month, which is for 2023, $10.65. So, in other words, if you qualify for these LIS or low income subsidy programs, okay, your medications will be lower and also your penalty will go away. Now, that is for the medication portion, all right? So that is the penalty for the medication. Now, there is another type of penalty that folks don't understand also, that is the late enrollment penalty for Part B, B as in boy. All right, so let's say, for example, again, I am turning 65, or I just literally continue. I am 67, 68 years old, and I continue my job. I continue pretty much with my insurance on my current job. And you know what? I just decide, I'm so sick and tired of my boss. I am 68 years old, and now I'm going to retire. Cool. But I forgot to call my human resources department and said, hey, human resources department, I'm going to be gone next month or next week or next day, right? So I go with a month, I go with 2 months without having Part B coverage because, hey, I turned 65 2 years ago. Since my job was giving me insurance, I declined my Part B, okay, the medical side. And now I just got upset with my employer and I just decided to quit because I am too old to take this, right? So a month passed, 2 months passed, and then boom, I realized I forgot that I had to apply for Part B. Guess what, folks? Social Security will punish you. Social Security will penalize you for having a late enrollment on the Part B portion of your plan. Now, anybody probably in the industry will know, but Social Security takes applications for Part B between January till March, okay? For those folks that are not eligible whenever they were supposed to enroll, or for those folks that forgot to enroll, and anybody enrolled between January and March, unfortunately, will not be effective or active under Part B for Medicare until July 1st of that year. So, what do I do from March till July until my Medicare start? I cannot see doctors. Now I am diabetic. Hey, what? You will probably going to have to do 2 things. Maybe paying over the out of your pocket, or trying to find an alternative like an Obamacare if you ever have to have a special enrollment period or in a special situation to enroll. Unfortunately, in the Medicare world and the senior population, forgetting things is pretty common. And sometimes it's hard for us agents to explain the rules. We wish to have the power to control and change the rules, but unfortunately, there is nothing that we could do in certain cases, but just, be an advisor and explain how things work. Now, how do I know that I was supposed to enroll in Part B? Whenever you turn 65, once again, you get this wonderful letter from Medicare, from CMS saying, hi, Mr. and Mrs. Client, you're going to be turning 65 next month. You were supposed to enroll into Part A. I'm sorry, no. You are going to be entitled to Part A because you worked 10 years, you qualify and accumulate 40 credits. Every year that we work and we pay taxes, we get 4 credits for Medicare retirement that at the moment that we need to, as long as we had 40 credits or 10 years worked, and paid taxes, okay, to Social Security, we are entitled to Medicare, right? So if you have that qualification, if you work the 10 years and you pretty much have the 40 quarters, you're going to have Part A and no cost. Hey, good for you. But what happens if I retire tomorrow or next month, okay, and my insurance is going to give me coverage? I have two options. I can either cancel my insurance with my job, go with Medicare, okay, or I can continue with my insurance and my job and cancel the Part B with Medicare. Some of the times people make this huge mistake because unfortunately in the Medicare population, once again, we are not educated, we're not informed per se, and the fact that you're going to get a check of $1,000, just I'm going to give you an example of $1,000, right? And your Part B is going to cost $160. Well, last year was $170. This year is $163. Like it or not, $163 is a lot for our senior population, okay? And they say, wait, what am I going to have to pay $163? I'm going to cancel this crap. I'm not going to pay that $163. I'm just barely going to get $1,000. I have to pay rent. I have to pay food. I have to pay medications. I don't need this. And they cancel it without having the proper information, right? Whenever they decide to get enrolled into a plan, and unless they have both Part A and Part B, okay, they can struggle paying out of pocket, paying pretty much a higher percentage for the medications and doctor visits because in reality, they don't have coverage. Now, coming back to the fact again, whenever you're retired, okay, and if your job or your employer is not giving you insurance, folks, you have to apply for Part B. Part B is optional only if your employer will give you insurance. If your employer will not give you insurance, you have to figure it out a way that you can manage that $163 for your Part B, because whenever you need it, and I promise you, for those that says, I will never need it because I'm going to Mexico and get my medications, or I'm going to the pharmacy down the street or the doctor down the street, I promise you, eventually you will have to have use of your Medicare coverage. Now, whenever you need it, unless, again, that you apply for both Part A and Part B, you cannot have a program. Now, what happened whenever you apply late? Social Security said, hey, Mr. Client, you were supposed to have this long time ago. What's going on? You barely applying. Guess what? We're going to give you the chance to get into Part B, but you're going to have a penalty. And that penalty is the 1% multiplied by the number of months that you were supposed to be enrolled in a Medicare plan, multiply also by the index of percentage of the poverty level. That also, it is pretty high, because if you were unhappy thinking that you were going to pay $163 for Medicare access, guess what? You're going to have also a penalty for your Part B, an extra portion of money coming out of your check just because you didn't enroll into a plan. So, with that being said, we have to understand that there is two types of penalties. Penalty number one, if I was supposed to enroll in a Medicare plan whenever I turn 65 or whenever I retire, but I didn't do it because I forgot, because I didn't want to pay the $163 that Medicare was going to charge me, or just simple, pretty much I didn't need it because I was healthy, okay? 5, 6 months, a year, 2 years later, you become diabetic, you had a heart attack. Now you have to have some sort of coverage, because now you're going to have something called long-term care services, or you're going to have access to a Medicare access and services for a while. You're going to have something to help you pay, and you cannot even buy a Medicare supplement. You can have the money now, and you cannot even have a Medicare supplement because you didn't have Part B. You have to understand these penalties are in place because at some point there were folks that didn't have use for the plan, and they were enrolling in a way or another, and now they pretty much, and they didn't use it. And now for those that need it at the time, that a real need, okay, they cannot get it unless they pay the penalty. And the same way, the only way that a person can get away with any of these penalties is if they qualify under the umbrella of being low income and having the application process for the low income subsidy or the extra help, okay, through the government, and being approved for that automatically will wipe off that penalty. There is no other way in the Medicare world that your penalty will go away unless that you apply and get approved by the government, by Social Security, by Medicare for these programs of special or programs of assistance program. So remember, guys, penalties is a reality, and unfortunately, we agents, the only thing we can do is tell you why is that penalty in place, and maybe help you understanding that might be a way that you can take it out. But unfortunately, our system, it is in place for a reason, because again, everybody is supposed to have something called credible coverage. Credible coverage whenever you turn 65 or whenever you retire, something that pretty much give you at least the access of your medications or at least the access of the basics compared what Medicare will do offer you. So if this information help you understanding why you have this extra money deducted from your Social Security check, hey, awesome. We want to help you understanding also that could be ways that you can get that penalty taken out, and also that you're not in the position to pretty much pay higher co-payments for your drugs or higher co-payments for your doctors because you didn't have the right plan. We want to help you understanding those ways that you can get, this penalty removed. For that, give us a call. We want to help you. Remember, we're local Houston agents. We're working with the majority of the plans. We know the ways that we can help you saving that money and also getting those benefits that you need. Give us a call at 281-743-8691. JWB want to help you. JWB is here local. We speak Spanish. We are in Houston, and we want to help you. Te queremos ayudar. With that being said, until next time.